Useful notes for the NPLEX board exam. Paradoxical emboli go from the arteries to the veins without a pit stop in the lungs. GGT levels are elevated in alcoholic patients. Loop of Henle has a tri-transporter for sodium, potassium, and chloride. Orthanine transcarbalaminase and carbamoyl phosphate combine in the mitochondria. Most kidney stones are calcium oxalate. Mucus drainage from the head goes into the sphenoid, ethmoid, maxillary, and then into the nasal passages. T3 is the active hormone, whereas T4 is the inactive form. Riddell's thyroiditis is rock-hard gland that happens mostly in females. Zollinger-Ellison syndrome is a pancreatic tumor that secretes gastrin. DeGeorge syndrome affects the parathyroid and thymus development failure. Cerebellar arteries are not part of the circle of Willis, but cerebral are. Vision deals with CGMP, while olfaction deals with CAMP. Stylopharyngeus muscle is innervated by the glossopharyngeal nerve. Medial geniculate of the thalamus intakes hearing, whereas lateral geniculate of the thalamus intakes vision. TORCH acronym stands for Toxoplasmosis, Other, which are syphilis, varicella zoster, parvovirus B19, rubella, cytomegalovirus, and herpes infections. These cause congenital abnormalities in the fetus. Basal nuclei helps smooth out movement. Cowdrey bodies are seen in herpes infections. Tay-Sachs disease is a deficit of enzyme hexomonadidase. Reiter's syndrome is reactive arthritis, wherein the patient can't see, can't pee, can't dance with me due to lower joint issues. The triangle of the neck in the posterior occiput is rectus capitis posterior major, obliquus capitis superior, and obliquus capitis inferior, and the subocciput nerve comes out between them. Calcium returns to the T tubules in the muscle. Hypothalamic set point is regulated by the anterior hypothalamus. Major histocompatibility complex 1 controls CD8 cells that goes to Th1 and is included in viral infections, whereas MHC2 controls CD4 cells and goes to Th2 helper cells. IgM is the first responder to infection. IgG is for memory. IgD has beta cell receptors. Anaerobes are most usually found in the nose, oropharynx, and gut. Viral infections acutely cause lymph increase and neutrophil decrease, whereas chronic viral infections is reversed. Bleeds post-intercourse are indicative of squamous cell carcinoma. Bacterial infections have neutrophils increase and lymphocytes go down. Natural killer cells are nonspecific intracellular policemen, known as innate lymphoid cells. ILC3 is to balance the microbiome and pathogens in the gut, and ILC2 is for worm infections. C3a is the major immune stimulatory protein. T cells are cell-mediated immunity. Ampulla is the primary site of ectopic fertilization. B9 is always needed for purine synthesis. Meiosis is for reproductive cells, whereas mitosis is for somatic cells and fertilized cells. Mitochondrial DNA is passed down from the mother. Lactose has beta 1,4 bonds that are difficult for us to digest, similar to cellulose. Glycogen starch has an alpha 1,4 base, and 1,6 are for branches. B1 vitamin is crucial for alpha-ketoglutarate dehydrogenase reactions. HMP is the pentose phosphate pathway, and ATP is not made in this pathway. Sorbitol is neurotoxic and builds up in diabetic patients that can't break down fructose. Chylomicrons bind to ApoE receptors. LDL binds to ApoB receptors. HDL binds to A1 receptors. Series 2 is for eicosanoids and a pro-inflammatory pathway. Delta 2,4 reductase turns desmosterol into cholesterol pathway. CoQ10 is made via the mevalonate pathway. Carnitine gets fatty acids into the mitochondria. CPT1 is on the outside of the mitochondria, whereas CPT2 is on the inner membrane of the mitochondria. Cysteine is the rate-limiting amino acid in the synthesis of glutathione. Muscles at rest use fatty acids, whereas muscles during exercise prefer glucose. Heart takes any fuel source, such as glucose, fatty acids, ketones, and lactate, and there are 5,000 mitochondria per cardiac cell. Subacute bacterial endocarditis is predisposed by abnormal heart. Mitral valve prolapse is the most common valve dysfunction. Bundle branches of the heart, the left are bifascicular, whereas the right are unifascicular. Raynaud's phenomenon is a secondary issue caused by scleroderma or systemic lupus. Scleroderma Crest syndrome stands for calcinosis, Raynaud's phenomenon, esophageal dysmotility, sclerodactyly, and telangiectasia. Raynaud's disease is a primary problem with vasoocclusion. Largest decrease in pressure happens at the arteriole due to high resistance. ACAT esterifies cholesterol, making it more stable and less active. Heme iron is unregulated. Non-heme iron is regulated transport via the transferrin protein. Reticuloendothelial cells are found in the liver, spleen, and marrow. These are leaky cells. Folic acid helps turn DUMP to DTMP for the synthesis of DNA. G6PD leads to peroxide increase, which causes a failure of red blood cells. Both thalassemias have teardrop cells, basophilic roughening, target cells, and hypochromatic and microcytic red blood cells. Multiple myeloma has Bence-Jones proteins, which is included with bone lysis and causes increased calcium. Acute myelogenous leukemia is the most common leukemia in adults and has hour rods and is very deadly. Chronic myelogenous leukemia has Philadelphia chromosome and it can be remembered via the city of manly love. Acute lymphoblastic leukemia has hepatosplenomegaly in kids around 4 years old and is curable. Chronic lymphoblastic leukemia occurs in adults over 60 years old and has well-differentiated B cells. Factors 2, 7, 9, and 10 are associated with vitamin K clotting via the extrinsic pathway. Hemophilia A is associated with factor 8 deficit and happens in males. Hemophilia B is associated with factor 9 deficit and is also affected in males. Hodgkin's lymphoma has Reed-Sternberg cells. Non-Hodgkin's lymphoma is most common lymphoma. Hemolytic infections classify beta is complete, whereas alpha is partial hemolysis. If the offending agent replicates in red blood cells, it is more pathogenic. E. coli O157H7 can make other bacteria more toxic. Salmonella enteritis is a very common gut disruptor. Proteus changes the pH, which causes kidney stones. Mycobacterium are acid-fast bacteria. Leptospirosis causes Weil's disease. IgG4 is for food allergens. Coccidioides is dimorphic. It is mold in soil, but turns to a spherule in the body tissues. Cryptococcus neoformans happens in AIDS patients. It is carried by pigeons and causes fungal meningitis. CMV has owl eye inclusions. Adenovirus is the most common cause of diarrhea in kids. Measles and mumps are RNA viruses. Measles has cough with coryza and conjunctivitis. Croup has subepiglottic swelling. Hepatitis B is the only DNA hepatitis. Influenza has non-productive cough, very high temperature. Rubella virus is in the Ruby virus family. Pox virus is the only DNA virus that replicates in the cytoplasm. Parvovirus B19 is the only single-stranded DNA virus. Epstein-Barr virus is also known as HHV4. The greater omentum is connected via the peritoneal ligament. Gastric ulcers hurt with food ingestion. Duodenal ulcers feel better with food ingestion. The jejunum has less pars patchers and vascularity than the ileum, which is also longer in length. String sign is found in Crohn's disease, whereas pseudopolyps are found in ulcerative colitis. Fistulas are more likely in Crohn's disease due to transmural involvement. Inferior mesenteric drain goes into the splenic artery. Myenteric and submucosal plexus is for intrinsic nerves. Myenteric does motility, and submucosal does secretion and blood flow. Cisterna chyli drains 3/4 of the lymphatic system, whereas the right lymphatic duct drains the other quarter of the body, which is the right head and upper right arm. This duct drains into the subclavian vein. Vitamin K moves calcium around and is associated with bones. 1,25-dihydro-D3 works with osteoclasts. 24,25-dihydro-D3 works with osteoblasts. Glutathione is preserved by ascorbate. Alpha-lipoic acid recycles vitamin E, C, and CoQ10. Vitamin E and D deficit leads to ataxia. Chromophobes don't stain well because they are filled with granules. Acidophils are growth hormone and prolactin hormone. ACTH and melanocytes increase accordingly. Primary disease is on the organ, secondary disease is on the pituitary gland, and tertiary disease is on the hypothalamus. Weeks of embryological development. Week 1, implant and divide. Week 2 follows with hypo and epiblast. Week 3 has 3 layers, the germ layers, and week 4 is for organ development. Neurosyphilis has tabes dorsalis and dorsal column dysfunction. Parkinson's disease affects the substantia nigra. Huntington's disease affects the caudate nucleus. Multiple sclerosis has demyelination of the CNS oligodendrocytes. Nucleus of Meynert releases acetylcholine. Locus coeruleus makes norepinephrine. Raphe nucleus releases serotonin. Ventral segmental area releases dopamine. Anterior pituitary gland is derived from the Rathke's pouch, and posterior pituitary gland is neurologically derived. Diencephalon makes the hypothalamus and thalamus and pineal gland. Epidural hematomas are acute and fast. Subdural hematomas are slow and involve the veins and do not cross over. Complement pathways. Classical is fast and efficient. Alternative is slow and inefficient. Lectin is for fungi. Suprachiasmatic nerve relates to the circadian rhythm. The dorsal column medial lemniscus crosses at the medulla. Diagnose hemochromatosis with Prussian blue staining. Osteosarcoma is common in males. Embryonal rhabdomyosarcoma affects the head and neck. Type 1 collagen turns into bone. Type 2 turns into cartilage. Type 4 turns into the basal floor of the kidney. Lymphocytes and macrophages will be apparent in chronic disease. Decreased osteoblasts are found in Paget disease and leads to picture framing of the spine. Polymyalgia rheumatica affects the girdles and has erythrocyte sedimentation rate. Consider scurvy for poor wound healing patients. The deeper you go, the sweeter it gets. Relates to the adrenals, and as GFR are the layers. MEN1 has the 3 Ps, parathyroid, pituitary, and pancreas. Cardiac tamponade leads to decreased blood pressure due to fluid in the pericardial sac. Syphilis has tree bark sign in the aorta. Rheumatic fever has Jones pneumotic, joint, O looks like a heart, nodules, erythema, and Sydenham's chorea. Lyme's has face pneumonic, facial paralysis, arthritis, cardiac block, and erythema marginatum. Toxoplasmosis has atrophy of the ventricles of the brain. For the intercostal muscles, remember X to sex is inhaling action, and in to chin is exhaling action. Barrel chest appears with emphysema as well as alpha-1 antitrypsin. Interstitial fibrosis leads to restriction of the lungs. Cystic fibrosis will get nasal polyps and reproductive sterility. Asbestos has iron bodies and honeycombing in the lungs and affects the low lung. Coal dust gets trapped in the upper lungs. Histoplasmosis is due to pigeon feces. Most organ development is at week 4 or 5 of gestation. Clara cells, otherwise known as type 2 pneumocytes, otherwise known as goblet cells, make surfactant. Type 1 epithelial cells in the lung conduct respiration. Carcinoid tumor of the lungs causes diarrhea, flushing, and cyanosis. Tuberculosis has cavity lesions. Non-smokers get Pancoast tumors and adenocarcinoma tumors. Nephrotic syndrome has proteinuria. Nephritic syndrome has hematuria. Minimal change disease is most common nephrotic syndrome in kids. Patients with sickle cell disease will have osteomyelitis if infected with Salmonella. Sickle cell crisis in the kidney leads to focal segmental glomerulonephritis. Post-infectious glomerulonephritis has subepithelial dense deposits of electrons and humps. Staghorn stones are associated with struvite material and alkaline pH. Spike and dome manifestations in the kidney from membranous glomerulonephritis. If it's an enzyme deficit, it's usually autosomal recessive. If it's a structural deficit, it's autosomal dominant. Agranulocytes have sites in the name, whereas granulocytes have fills in the name. Spleen is derived from mesoderm. Disaccharides are SLIM acronym: sucrose, lactose, isomaltose, and maltose. Biceps brachii inserts onto the radial tuberosity and flexes the elbow joint. The 5th digit, toe, does not have sesamoid bones. Hyperextension of the spine affects the anterior longitudinal ligament. Primary curves of the spine are sacral and thoracic. Ischial spine is on the posterior pelvis. Humerus has coronoid fossa. Superior dislocation of the humerus damages the acromioclavicular ligament. The acromioclavicular joint does not have a disc. Subscapularis is the anterior portion of the rotator cuff tendon. Annular ligament is not in the wrist, it is around the capitulum of the radius. The patellar ligament inserts on the tibial tuberosity. The ligamentum flavus is the most dorsal spinal ligament. Inguinal ligament attaches to the anterior superior iliac crest and the pubic tubercle. The palatine bone makes up the posterior part of the 1/3 hard palate. Muscles at rest use fatty acids, while muscles in exercise use glucose. Obturator internus muscle laterally rotates the femur. The masseter is innervated by the trigeminal nerve. Transversospinalis group of muscles contains the semispinalis muscle. The jejunum has fewer arterial arcades and lymph than the ileum. Fundus of the stomach and spleen is not part of the epigastric region. Bronchial arteries supply the lungs with oxygenated blood. Apex is 4 centimeters above the first rib for the lungs. Radius and ulna both don't have a neck. Phase 1 of detoxification uses CYP450 enzymes, whereas Phase 2 uses glutathione, etc. Mandible does not have a coracoid process. Cancer grading, cellular differentiation. Staging of cancer is extent of spread. Series 2 is for arachidonic acid processing for inflammatory pathways. Interior cerebral artery stems from the common carotid artery. Most of the mesenteries are drained via the inferior mesenteric vein. Smooth muscle is only in the gastrointestinal, eyes, and urinary systems. The central nervous system has the longest window for teratogen sensitivity. The lateral sylvian fissure divides the frontal and temporal lobes of the brain. The placenta does not do protein transportation to the fetus. Lateral ventricles are the most superior ventricles in the brain. Cranial nerves 3 and 4 are not in the medulla. Cranial nerves 5, 6, 7, 8 are in the pons. Substantia nigra is in the basal ganglia. Primary dysmenorrhea occurs in the absence of pelvic pathology. Secondary dysmenorrhea has an identifiable etiology. Primary is more likely in someone whose concerns begin right after menarche. Secondary dysmenorrhea symptoms begin after age 20 after previously painless cycles. Chylomicron use goes ApoE, VLDL, and IDL, and LDL use B100, and HDL uses A1. CHF Pericardial Effusion is most often transudative and lacking protein. Also occurs in nephrotic syndrome, hypotension as well. Exudative effusion is caused in tuberculosis. Adrenocortical adenomas cause Conn syndrome, which is primary aldosteronism. Acute pancreatitis is associated with fat necrosis and causes hypocalcemia, whereby it collects fatty acid calcium soaps. Dipeptides and tripeptides enter the cell via the intestinal lumen by hydrogen ion dependent cotransporters. Oxidase negative bacteria are usually anaerobes, but the vice versa is not always true. Bacterial bronchopneumonia will have patchy consolidated areas of acute suppurative inflammation in one or more lobes. Respiratory acidosis may occur due to fluid accumulation in the alveoli. Basal lamina of the kidney is situated between the glomerular capillary endothelium and podocytes. Renin in the kidney is released from juxtaglomerular cells in the afferent arteriole. In muscular dystrophy, dystrophin muscle protein is absent. Major regulatory proteins of muscle tissue that control contraction are troponin and tropomyosin. MAC complexes are directly initiated when C5b binds to the cell membrane. Diabetes type 2 can lead to coronary artery disease, which leads to death. ALL has pancytopenia. Dermatomyositis has vasculitis conditions. Endomysium covers individual muscle fibers. Gilbert syndrome has a decrease in UDP glucuronidinosulfonyltransferase. VLDL removes triglycerides from the liver. Renin-angiotensin-aldosterone system leads to vasoconstriction. Lamina propria is loose areolar connective tissue. D3 converts to 25-OH-D3 in the liver. Calcitonin decreases osteoclastic activity. Sphingolipids and phospholipids are in the spinal column. Calcaneus tendon is innervated via the tibial nerve. Phenylalanine hydroxylase is defective in PKU, and a musty odor from PKU patients is due to phenylacetic acid buildup.